the effort to repeal and replace Obamacare was and there's been no bigger political failure across the last couple decades, I don't think, than that. I mean, it was the idea that atrocious. A lot of those HHS appointees were supposed to sort of take point on different elements of that process? Was that sort of the mandate of that first V1 HHS was to steer that process? I don't think they were really steering much of anything. They were taking orders from the Domestic Policy Council in the White House and from higher ups in the White House, and who in turn were working with some rather junior heads of major committees in the House and then also in the Senate. And all the people who seem to know anything about healthcare just seem to kind of disappear or stand by the wayside. I mean, Paul Ryan was Speaker of the House, and he had been just outstanding in the initial Obamacare debates, but he all of a sudden just sort of went AWOL. And so what they ended up with was, and this had never been an issue that Trump had cared personally about. You could tell on the campaign trail, and it showed. I mean, it wasn't like he had somebody who really knew what he was doing or she was doing to lead the effort. What they ended up with, to kind of make a long story short, is a repeal and replace package that was so bad. I mean, why was it bad? Well, it would have done nothing to repeal Obamacare. All the worst elements of Obamacare would have stayed in place. New bad elements would have been introduced that would have raised costs even further in some cases, many cases probably. And then you just would have had this bipartisan gloss on this horrible legislation. I mean, across the years, I fought this Obamacare fight from the very beginning, from 2009 onward. And I would sometimes imagine how bad could an establishment-based alternative end up looking like. I never thought it could be nearly as bad as the one that emerged. But there was no bipartisan element on the table to fix Obamacare, was it? No, in the beginning of the Trump administration. I mean, it was going to be just Republicans focused on it, right? Yeah, you would have thought it was a bipartisan thing. We would have thought it was Democrats leading the negotiations in terms of how bad it turned out. I mean, so in terms of the things that it maintained that were the worst parts of Obamacare, what were some of those? Well, the things that drove up the costs in Obamacare, and HHS did a study that showed this. The community rating and guaranteed issue provisions. What that really means is the part of Obamacare that said you can no longer charge somebody more for getting health insurance after the problem has already come into existence. Kind of the equivalent in health insurance of allowing someone to buy homeowners insurance after their house is on fire. Or car insurance after they've had a wreck. So the colloquialism for this is pre-existing conditions, right? Yeah, right. And so instead of fixing what the federal government had already messed up on this, and there were some bad things that needed to be fixed. Like, for example, if you had insurance on your job and then you went to buy insurance on your own after leaving your job, the insurance companies would conveniently pretend that they never knew you had insurance on your job. It could be the same insurance company. All of a sudden, they'd charge you more for pre-existing conditions. And that should never have been legal. But this whole dichotomy of employer-provided insurance and individually purchased insurance and the differences between them was, again, a product of the federal government, of treating each of them differently under the tax code. Employer-provided insurance got a big tax break, and individually purchased insurance didn't, and played by different rules. So instead of... And that's historical, or was that particular to Obamacare? No, that was historical. Okay, yeah. So instead of fixing these very real problems and allowing people to slide from the employer market to the individual market and back and not pay for pre-existing conditions that they had covered, not pay more for them, Obamacare's way of dealing with pre-existing conditions was basically to just outlaw the notion of insurance, namely that you have to buy the protection before the thing happens you're protecting against. That's how money comes into the system. Otherwise, costs skyrocket. And as that HHS study showed, I mean, it was like 70% of the increase in costs in Obamacare were a product of these things. The Republicans weren't trying to address that at all. Now, to be fair, it was extremely hard to address because the only reason the Democrats got those through is because, you remember, they briefly had the 60-vote majority in the Senate to overcome the filibuster, and then that didn't last long. You had Scott Brown beating Ted Kennedy because that's how much people hated Obamacare. But the 60-vote threshold allowed them to do it. Republicans didn't have the 60-vote threshold to undo it, but they utterly failed to realize the importance of it. And so they're leaving this worst part of Obamacare intact. Another bad part was the big expansion of Medicaid under Obamacare. Most Republicans wanted to keep that, most establishment Republicans. What does expansion of Medicaid mean? more Medicaid coverage to more people who are not poor, more federal spending on Medicaid when it's already a leading driver of our debt. So Republicans were going after none of the worst things in Obamacare. And then they were ready to throw themselves a parade and claim to have repealed and replaced it, which would have been just nauseating.
What was the new stuff they were trying to add in that would have exacerbated the problems?
It was comparatively small potatoes compared to what was just being left. But I don't remember all the specifics, but we used to run analysis about how, I was running things that showed that the insurance companies are now offering this price. You're basically guaranteeing this much money. Well, the insurers are going to go up to there. You're going to have a huge increase in costs in a lot of places. It would actually make Obamacare worse in a lot of ways. And then on top of that, it was always an issue that Republicans had been united in opposing Obamacare. Now they're going to kind of make it a hybrid, a bipartisan effort. And I frankly think John McCain did the country a favor by saying,
yeah, I think that's right,
down on it.
So, okay. Republican president gets elected in a few years. In broad strokes, what is the good Republican healthcare plan that can reasonably pass look like? Well,
at this point, it's been botched so badly that my hope is really just in trying to keep the employer-provided insurance strong and have that be the bulwark. As long as most Americans are happy with the health insurance they get through their job, they will not want to have socialized medicine.
Yeah.
And that's the number one thing that people who care about freedom and free markets and good health care can push for now is to make sure employer-based insurance stays strong. Now, libertarians don't like employer-based insurance. They think it's theoretically impure and that you should be able to shop around for your own insurance. And I agree, but you got to look at the political realities of where we are. And the only reason that the Democrats have not pushed for the Bernie Sanders style, full on socialized medicine is because they know that you've got whatever it is, 100 million Americans or whatever who get insurance for their job and want nothing to do with the inferior health care they would get as a result. Now, in a really rosy scenario, you could have a president who comes in, really understands the issue and is willing to take on the Obamacare pre-existing conditions rules and say, we need to make insurance legal again with healthcare. Obamacare basically outlawed something that goes back at least to the Renaissance. This great idea if you pay in because you don't know what's going to happen, and then if something bad happens, you're covered. And they said, no, don't worry about paying in. And then when something bad happens, you'll be covered anyway. So insurers just jack up the premiums to extraordinary degrees, where insurance is now so unaffordable. So you have to have somebody who's willing to make the case publicly that the pre-existing conditions parts of Obamacare are the worst part of Obamacare. But that's going to be coming from like almost a total standstill for someone to do that at this point.
It's interesting. At a conceptual level, I've thought a little bit about employer-sponsored health insurance. Follow my train of logic and tell me if I'm wrong. Employer-sponsored health insurance made a lot of sense as as the American economy was really maturing in the middle of the 20th century, because you could generally expect that someone would be with their employer for several decades, and that employer had a interest in someone's long-term health and well-being, because all of the time that they were investing into their employee in training in terms of building them up would be wasted if the employee got sick or was unhealthy. And so in an interesting way, really the ideal win condition for employers was really healthy employees, not just competing to give the best health insurance, because they were actually interested in their long-term health, not just giving them a ton of goodies for when they need to go to the doctor or when they need to buy pharmaceutical medication. Now we live in an economy where someone is likely to switch jobs at least a dozen times in their career. That incentive structure has broken down, and I can't help but wonder if the logic tree goes that you have an economy where people are going to constantly bounce from job to job over the course of their career, which I don't think is necessarily a good thing. I do think some level of stability in people's career is part of the American dream. If that's the case, does the employer-sponsored model no longer work from an incentive structure.
Well, I think it still works because even if you switch jobs, people want a job that has good health insurance coverage, and they'll demand it in most cases.
But coverage is almost missing the point. It's if you're at the point of coverage, it means something has gone wrong, and now you need to pay for it.
Well, health insurance,
right?
Health insurance.
Well, the point I'm making is that I get the sense that employers used to have an interest in their employees' health, and now their interest is in providing the best health insurance. Those are two different things.
Yeah, I guess I don't really know how much I believe that employers really thought too much about their employees' health all along. They always wanted to provide the incentive structure they needed to keep employees happy. And not to say they didn't care, but I think that the motivating thing was to make sure people had the insurance they needed. And I think that's still basically true. I mean, I see what you're saying. I agree that like there's more of a natural tie to the employer when you have a career with IBM or whatever with one employer.
I think this is especially operative on the blue collar end. You know, these employers had an incentive to provide work conditions that didn't wear down their bodies as much and everything, and then also ensuring that they were taken care of in a way that they'd be able to still work at the factory in 40 years or whatever, and that's broken down a lot.
Yeah, I still think though that as long as employees are demanding good insurance for the employers will offer it, and it is theoretically better, I agree, to have people go shop for their own insurance separate from their job and be able to carry that with them in a portable way throughout their lives. But Obamacare has made that basically impossible because you cannot go buy your own insurance now without all of the Obamacare rules coming into effect, which includes other people don't have to buy the insurance to claim it. And so the people who do buy it pay the extravagant costs necessary to cover other people who are not paying in. So Obamacare's ruined the market for individually purchased insurance. And unless you have a Republican president and Congress that is willing to say that, and we need to repeal these pre-existing conditions, parts of Obamacare, we need to replace them with pre-existing conditions, legislation that's consistent with actual insurance and actually works. All you're left with is the choice between employer-provided insurance and socialized medicine. And in that scenario, give me employer-provided insurance, any day of the week and twice on Sundays. I think employer-provided insurance has always made more sense, though, also than a lot of people who are looking for sort of theoretical purity on the right have wanted to admit. I mean, it's one of these sort of quasi-organic things that worked out pretty well. Again, there is a federal government hand in it, though. Like the federal government didn't want to allow wage increases and bidding wars during the worker shortages of World War II. And so they started allowing companies to offer this, and they gave a tax break for employer-based insurance that they did not give to individually purchased insurance. And that is the root of the problem that's haunted us. And instead of equalizing that tax treatment and allowing individual insurance to prosper, we now have Obamacare effectively outlawing individual insurance, and the government controls all that. And all we're left with is the bulwark against socialized medicine.
Yeah. What is the best country, it's a first world country, on healthcare?
I don't actually know. I've never really come across one I thought seemed particularly attractive. I mean, we still have the best healthcare, I think. And
so what's the
most choices if you can afford it?
All the other alternatives.
I mean, you hear people praise like Singapore's system. I certainly wouldn't want to be in Great Britain. I don't know. I mean, I don't think most of these, most of the socialized models are an absolute nightmare. Look how hard, just for a little taste of it, how hard it was for people to get in to see the doctor during the COVID period. You're seeing, I mean, the effects of that still. And I was pretty shocked to see something I was reading the other day that the excess mortality rate in America in 2022 was apparently 15% higher, according to the article I read. I didn't have a chance to independently check it, but excess mortality is 15% higher in 2022 than pre-COVID in 2019. So you're having these lingering effects of people not getting in for healthcare treatment during the COVID period and denying, regular visits. And it's not, the best evidence that this is not long COVID is that Sweden, which of course followed the model of every other society in all of human history and just, didn't pretend that they could artificially stop a highly infectious virus, they have not had the excess mortality of late. So it suggests it's not long COVID. It's sort of long COVID policy or whatever.
Is long COVID real?
Oh, yeah, I think long COVID is very much real.
Really?
It's thankfully it's a minority of people, but yeah, I mean, I've known people firsthand who have some pretty bad lasting effects from COVID. And it's a pretty bad virus. I mean, even though our way of dealing with it was arguably even worse than the virus itself, but it was the worst thing to hit since the Spanish flu of 1918, which was way worse and killed off tons of people in their 20s and 30s and left orphans in its wake, whereas COVID mostly affected people who were toward the end of their lives and not in great health. But the long COVID thing, I think, is real. I mean, how extensive, or I think it's probably hard to sort out in a lot of cases.
It's a little bit of a weird thing, but I haven't seen a lot of people talking about it. My sense is that something odd has probably happened to the actuarial tables because of COVID. You have a ton of people that were sort of likely to die at some point in the next 10 years who kind of died all at once. Are there going to be any funny consequences? Not funny, like haha, but like any interesting consequences in public policy because of that over the next few years?
I don't know. It's a good question. I mean, I think you would hope that, like, if you have an inordinate number of deaths in one year, that you'd have fewer subsequently, but we're not seeing that. And I think it's because we have fewer than we did at the height of COVID, but we still have a high number in terms of historical norms, apparently. Again, I haven't substantiated that independently, but, because I think we've just let our healthcare system sort of function like our schools during COVID, right? People weren't seeing people face to face. Everything was sort of short-circuited, short-changed. And so I think we see lingering results from that.